My name is Adriana de Franco. I use pronouns she, her, and hers. And I'm a community engagement lead for Brightline in Los Angeles. I'm going to let Yasmin say hi now, and then she'll come back and do her part of the presentation as well.
Thank you. Yes, hi guys. My name is Yasmin Arias, and I'm a customer success manager here at Kooth, which powers Soluna, and I'm excited to be here with you guys. Adriana, did you want to go forward and talk about today's agenda, or
yes? Thank you. Okay. Yeah, I'll take from here. Thank you so much. So this is our agenda today. So with our missions in mind, today we'll be going over how we got here. Why is this service free for your families? An overview of the resources of both programs, and we're going to have time for questions and answers at the end. So please hold your questions, and we'll be glad to answer all of them. So just a quick reminder to keep in mind that BrightLife Kids, it's powered by Brightline, and that's who I am representing. And Soluna is powered by Kooth, and this is Yasmin who will be talking about it. We're two separate entities partner together to support California's youth. To share a bit more on how we got here, Brightline and Kooth were selected from over 450 vendors as the behavioral health virtual services providers under the Children and Youth Behavioral Health Initiative. This is a California initiative by Governor Newsom. We're both funded by the Department of Healthcare Services, which makes both BrightLife Kids and Soluna completely free throughout the state of California. As you can see on the slide, we proudly stand as one of the 15 work streams driving this effort forward. So let's explore how BrightLife Kids and Soluna seamlessly integrate into existing care delivery models. So at the top of the pyramid, we have the licensed therapists and physicians, and they often manage specific concerns and symptoms. And it's focusing on higher acuity needs. That's not what we're doing. We are coming at the bottom of the pyramid to serve most of the population with our subclinical model, where we emphasize prevention and earlier intervention. We're building essential life skills and fostering a supportive digital environment to support our families, so they don't need to look for the services on the top of the pyramid, where we know there is more waiting lists and less services available. So both of our resources were launched in this year, January 1st. So we're very excited about it and very excited to share this information and to see the impact that we're going to make through the state. This slide provides a visual of our services and differentiating what BrightLife Kids is and who is Soluna. And we'll be sharing the deck later today, so all of that information you're going to have access to. Let's start with BrightLife Kids. So BrightLife Kids offers support for every children in California, 0 to 12, right? We are powered by Brightline. Brightline is our company that was founded in Palo Alto, California in 2019. We were created to address the pediatric behavioral health crisis even before the pandemic hit. Since then, we have been at the forefront, providing nationwide mental health support for kids, youth, and families through insurance and employer plans. On the commercial side, we have more than 60 million lives that we cover. So then we were chosen by the state of California to provide BrightLife Kids. This is a program that offers free behavioral health support for every family in California with children 12 years of age and under. We're designed to be accessible to all, regardless of income, insurance, or immigration status. It's entirely free. You don't need an insurance, or you don't need to have a referral to sign up and use the services. We are available virtually to your phone, tablet, or computer. Our coaches are bilingual in English and Spanish, and we also offer translation in 17 medical threshold languages. Our coaches address a range of issues, from developmental milestones to emotional well-being, anxiety and school stress. So in yellow, it's things that we can cover, and you, as you serve your families, you know much better than I do what your families need at this moment. So what we're doing, we're prioritizing prevention and wellness, aiming to support families before issues arise. A little bit about how we're going to serve this wide population, right? So from 0 to 6 years of age, we're offering the Parents Train Manage program. So we're coaching and assisting the parents and caregivers in understanding their children's development, establishing routines, and navigating the challenges such as, for example, managing big emotions or tantrums. From 6 to 12 years of age, here we have our dyadic coaching. And this involves both the child and the parent. So here the child will be able to come for the coaching sessions with the parents. And the coaching sessions will cover, for example, skills to navigate interpersonal relationships, fostering academic success, and managing transitions within the family dynamic. And the last, not the last, but the next slide, please. So who are our coaches? They are highly qualified. They have a master's degree in health-related field or a bachelor's degree, plus the coaching certifications that you see there. They bring over 5 years of direct experience working with children, youth, and families. And upon being hired, they get 80 hours of skills to develop even more. Our diverse team is trained to support the LGBTQ+ and the BIPOC and gender diverse population. So the idea with our coaches are they're mimicking the diverse population that we have in California. And families are able to choose the coaches they want when they sign up to our program. So how you get started, it's easy. You can download our app. At the moment, it's an iOS app, but we're gonna have one for Android soon. Or you can visit our website. You sign up by entering minimal details, the email and the California zip code, and you have access to the free resources. You complete a quick assessment, and after completing the assessment, you have 3 ways of using our services. The first one is the digital tools, and these are personalized digital contents for the families. For example, articles, podcasts, or exercises based on each child need and age. The second resource is the availability of our coaches. So families can sign up to live sessions. And as I mentioned before, the family is choosing the coach that they want to use so they can see the photo and read the bio. Coaching sessions are 30 minutes, and it's once a week. Parents are also able to text coaches between sessions, so they can keep the conversation and asking for tips if they need between the weekly sessions. And the third piece of the services we're providing is the care coordination piece. And here is if the family needs services that is outside what BrightLife Kids. So our care coordination coaches will be able to help your family to find the other services, for example, therapists, or something that we don't offer inside BrightLife. So I think the next, yes, thank you. I'll pass now for Yasmin. Thank you so much for your attention.
Thank you, Adriana. And I know that you plan to put some of your information in the chat feature also, so that'll be nice if you guys do want to connect with her directly. But yeah, so just as mentioned, my name is Yasmin. I am your customer success manager at Kooth, which powers Soluna. And Soluna is a CalHope program and a mental health app that serves ages 13 to 25. So that's the age group that we service. And just to touch briefly, we were founded over 20 years ago in the UK. So we're new to California, but we have provided over 1 million hours of professional support and provided almost 11 million youth aged 10 to 25 for that area with access to mental health resources. So we're just growing our team nationally right now, getting started in California. area to grow and continue those efforts. And something too that's really important about the product and the platform is that we really do place priority on research and feedback, user feedback specifically. So the app really is designed based off of what we've learned that our young people need the most. And overall, it's just free, it's safe, and it's an accessible space for users and youth to get support. Within the app, you'll see 3 tiers. So our app, again, designed entirely and created entirely from user feedback and evidence-based research. So even the constellation themes, the color schemes, all of that is a result of user feedback. And each of the tiers is really just meant to offer youth who might be struggling with preclinical, emotional, social, mental health challenges, all of that, just by providing support like digital education, self-monitoring tools, and even one-on-one coaching. So to dive a little bit deeper into those tiers, the tier 1 is going to be self-guided resources. So you'll see healthy habits, goal setting, personal reflection through journaling, all of that just to be a foundation for their overall well-being. And then tier 2 is going to be all of the coaching, or sorry, not the coaching, that's tier 3. Tier 2 is additional content. So it'll be activities, discussion boards, helpful articles even that come from our content team and the users as well. But something to note about tier 2 is that everything is pre-moderated. So anything that gets posted is going to be safe, it's going to be kind, and it's going to be appropriate. So we really do want to make sure that, because it is also anonymous, fun fact, that we don't have anyone revealing their personal information, things like that as well. But our user research did show young people feel more comfortable contributing anonymously too. So we've fallen in line with that. And then tier 3 is going to be the professional support. So that will be the coaching. We have behavioral health coaches. They provide sessions and guidance. They can drop in if they like. They can schedule one for the future, whatever is most appropriate for them. And within that same tier, we do have a searchable repository. So that's going to be, if they need food banks, emergency shelters, whatever it may be, they can dive into those resources on their own, or they can dive into it with a coach as well. So really, really neat resources and tools that they can make use of. The subclinical model, again, really just prevention and early intervention is the goal. So we do focus on the massive missing middle. So the vast majority of young people who don't have a mental health diagnosis, maybe are not facing immediate crisis, but are struggling with preclinical, emotional, social, mental health challenges. And really just want to build those essential life skills, address those common concerns like stress, relationship, emotional well-being, all of that, and really just have early intervention before a crisis emerges. And then we do have our universal support framework also. We don't want to replace, we don't want to override any existing services. We just want to support them. We want to bridge the gap, really complement existing supports. And we really do see it as being a two-way referral road. So we see community organizations, schools, doctors' offices, all of them referring young people to the app, since it is a 24/7 resource that they can use, with the exception of the coaching, which is from 10 a.m. to 10 p.m. With the last session being at 9, so they can allow for the chat time. But yeah, just really being a valuable addition to whatever support that they're already receiving from, those providers or programs. And then just to talk a little bit about safety, also revisiting, it's at the core of everything we do. So pre-moderation really just allows for that risk identification and intervention if needed. The anonymous service model fosters a safe and secure environment. Users can just be themselves and feel confident about what's really going on and really being able to share what's really going on. We adhere to all local, state, and federal guidelines in our reporting and regulations. And most of all, we prioritize the autonomy and the empowerment of our users, and we want them to be as much in control of their well-being as we can possibly get. And yeah, so that's really good. And with the pre-moderation as well, for example, in the journaling section where they're able to do, yeah, it is really a great resource. But even in the journaling section, if they do post something that's like suggestive of risk or something like that, that gets flagged to our coaching team also, who can intervene and provide them with additional resources based on what their journal entry is. So those are really neat little pieces in the app that are just special, and really add to that extra safety aspect. And then kind of just giving you an outline of what a partnership journey would look like if you wanted to roll out Soluna to your community or to your organization. We really just want to keep it low lift and high impact. So really guided support on my end. We would start with a discovery kickoff call. So that's where you reach out to me and say, hey, really want to learn more about Soluna and how we can get this going with our organization. And we work to identify those resources and create action items so we can promote. And then we also always encourage, bring on whoever else you think is going to be able to benefit from a conversation like this. And then we'll just come up with a plan from there, announce our partnership, and then we'll ensure the population that you serve is aware of Soluna. Everybody feels confident navigating the app. And then we'll continue to keep in touch and enable the young people that you serve with as much value as possible from our platform. And then from there, it's just ongoing engagement. So kind of overview is it's collaborative. It really just wants to make sure that we are introducing the app directly to students or to youth, but we're also supporting stakeholders like yourselves with ongoing promotion for your learning community. All right. So with that being said, we really do look forward to partnering with you guys if you think this is going to be something very beneficial for you, and be able to discuss some of the ways that we can offer you additional support as well. So with that, we have partnership opportunities. We have digital toolkits that we can send you, email templates, digital material for your websites, social medias. Something else too that we can offer is printed materials. So if you need flyers, posters, whatever it may be to kind of get it off the ground there. And then of course, if you need staff PDs or any meetings at all that you already have going on like this one, we can hop into, share more about the platform and how to best refer youth to it. And then, of course, in-person events and things like that we have available.